Insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. And a lot of people have expressed interest in this new article entitled Health Leaders on Drug Company Boards, a Conflict? Well, what's this all about? Well, it's about patients going to big hospitals and getting chemo. And often they feel like they're getting chemo. And sometimes they try to get a second opinion and they hear chemo, and they don't understand why they don't hear about other things. And some people come and say, Dr. Lederman, if radiosurgery is so fantastic, why don't I hear about it more? Well, that's a good question. Well, look at this article in the Washington Post. And again, the reference is April 1st, published by Associated Press. And the article is entitled Health Leaders on Drug Company Boards, a Conflict. And the article goes on to say that leaders of many United States academic medical centers sit on the boards of some of the world's biggest drug companies, which a study suggests raises the potential for worrisome conflicts of interest. Well, yeah, if your doctor is sitting on the board of a drug company and the purpose of sitting on a board is to make sure the drug company is profitable, how would that doctor behave? The article goes on to say that industry board members oversee company decision-making and have a financial responsibility to company shareholders. These duties could potentially compromise decisions medical center leaders make that affect patient care, education, or research. In 2012, so just recently, they found that 16 of the 17 largest United States pharmaceutical companies had at least one board member who also held leadership positions in some of the 30 academic medical centers. They included CEOs, medical school deans, hospital directors, trustees, and clinical department chiefs. Now, how much were the drug companies paying these doctors to show up at a few meetings a year? Annual compensation ranged from $107,000 to over $500,000 a year. Wow. Now, some would say the board ties could be useful, that you could bring all the information from the hospital right to the pharmacy company. But there's also the question that the door is open to industry influence over important medical center or university decision-making and may negatively influence the perception and trust of patients, students, and the public. The study was published this week, Tuesday, in the Journal of the American Medical Association. The data was collected from hospital websites, proxy statements, and shareholder reports, and from the United States Securities and Exchange Commission's public database. So a response was that we take seriously the importance of objectivity in research, education, and patient care, as well as our governance activities, one hospital said. But when all this money's flowing and the board members are responsible for the success of the pharmacy companies, you might wonder when you're getting a recommendation, is it a pure recommendation? Is your doctor getting support from a drug company? Is that hospital getting support from a drug company? I know my alma mater, Dana-Farber, recently was in the news for getting $65 million from drug companies. How that money might influence decision-making. And that's the beauty of coming to a private cancer treatment center where there is no secret money. When a patient comes to us, you or your loved ones, we're there for you. You're our boss. You're the reason that we exist, not the drug company. And so when people come and say, well, why didn't I hear about fractionated radiosurgery from my chemo doctor? Maybe there's many answers, and maybe some of them aren't so revealed. And that's the beauty of getting a fresh second opinion. So before you leap, or if your chemo is not working, or if your chemo is not tolerated, you might think about other methods of treatment, and there are often other methods of treatment. We don't guarantee results. You can't guarantee results, and medicine guarantees aren't meaningful. And if someone guarantees you something, you better reconsider. But think about other options that make sense, and not only make sense, for which there's data. And we've treated about 20,000 patients with primary and metastatic cancers, often in people who haven't had good results with chemo or surgery or standard radiation. And most patients that we treat, not every patient, but most patients we treat, have a good response with cessation of growth or shrinkage or disappearance of the cancer we treat. And usually it's just 5 treatments. Each treatment is about 15 minutes. Usually it's very well tolerated. And side effects, unlike chemo, which goes from head to toe, side effects are usually pretty minimal and often none at all. So if you have a question, you're welcome during the show to call us at 800-321-0710, 800-321-0710. And during the week, or if you want the booklet DVD about our work, just call us at 212-CHOICES, 212-CHOICES. Now, while we're talking about hospitals, I just wanted to bring up this other reason why you may be reluctant to go into a hospital. Federal officials said that in 2011, there were 722,000 hospital infections. About 1 in every 25 patients contracts an infection while in the hospital. And 75,000 people with infections died. 75,000 people died in hospitals. About 1 in 9 people with hospital infections die. So again, in the hospital, 722,000 people have infections, 2011, and 1 in 9 or 75,000 die. So often there's super bacteria, super bugs. This was reported in the New England Journal of Medicine, so it's a serious study published in a prestigious journal, and it's worrisome. So for people thinking hospitals are the safest place, you might think just the opposite, that if you can stay out of the hospital, you're more likely to avoid some of the complications which are commonly seen. And in hospitals, there's a lot of very sick people getting super bacteria from super antibiotics with super resistance. And so it's another reason why you may want to stay out of there. Stay out of there if you can. Again, that's why we have a private cancer treatment center. There's no hospital. There's no ICU. There's no super bacteria. There's no super antibiotics. So we don't see those super infections, except in patients that just got out of the hospital. We had some interesting cases this week. One man came with prostate cancer. He unfortunately was diagnosed when the cancer spread to the bone, and he's had some pain. He had terrible pain in his head and had a huge mass of cancer in the skull bone behind the ear. We treated that mass with just 5 treatments, pinpoint radiation, radiosurgery. And guess what? It's not hard to guess. Actually, his cancer and his pain went away. We just treated a tumor in the pelvis, and similarly, that pain went away. So radiation, radiosurgery, focused beam is very effective for cancer and very effective for cancer pain. And if you or a loved one are having pain from a cancer, you may want to give us a call, because most likely we can quickly make it go away or improve. And we have another patient who came in this week, an 80-year-old man from South America with a pancreas cancer. Now, he came to us 3 months ago with this pancreas cancer, and he didn't want to be treated. He wanted to wait. He wanted to go home and wait. And now he came back this week, got a new scan. We staged him up, which we believe is very important to get staged. And getting staged, the cancer has now traveled to the liver. So it's gone from a localized cancer to one that's metastatic, most likely because he decided to wait and go home. And this is a recurring theme. Waiting is not necessarily such a great idea for people with cancer, because the cancer is not waiting. The cancer is growing. The cancer is doing what cancer does, which is to grow, trying to take one's life. So for this man, he went home and he had a nice vacation, but the cancer didn't take a vacation. So the advice here is, and again, a recurring theme for people who wait to start treatment, the cancer's not waiting for you. So give us a call if you wish. We promise to see you within 1 business day if you wish. We don't believe in making people wait. So we just don't think that's useful. And on the same page, we had a patient come in, a man came in on Friday, being treated at a hospital outside Manhattan. He got an MRI to look at his liver, and he was found to have a kidney cancer. Now, this was 6 months ago. So then, for whatever reason, he or his doctors decided to repeat the test in 3 months. So they got another test, and it's still there. And he came and heard about us, came without any papers. We called and got all his paperwork. And he's planning there to get an ultrasound in another 3 months. So, gosh, he's got a cancer in the kidney by appearances. He's waited now since September, no treatment. And what does cancer do when you wait? We're going to hear from the man with the golden voice, and we're here to take your calls. If you wish, you can call us at 800-321-0710. 800-321-0710. We're live at the WOR studios. Here's the man with the golden voice.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call